Sure. So CAR T cell therapy, when the CAR T cells are expanding, this is good. They will go and eliminate the tumor when they can. But they release cytokines that then also activate other cells in the body that can release more cytokines. And this leads to two major toxicities of CAR T cell therapy. One called cytokine release syndrome, which is associated with fever, but can often go on to cause damage to organs. The second toxicity is related to that, which is a neurologic toxicity that we think that the cytokines then increase the blood-brain barrier permeability and thereby allow patients to become confused because some of the cytokines and toxins of CAR T cell therapy are now able to get into the brain. Now, different investigators have thought of different ways to try to decrease this cytokine release syndrome. And so, for example, there's a trial underway called ZUMA-19 that has an antibody against a cytokine called GM-CSF. And the thinking there is that this GM-CSF is particularly important for causing the toxicity, but not so important for the CAR T cell expansion to do what they're doing. So the hope is there that we can dissociate the toxicity from the efficacy and really keep the good parts of CAR T cell therapy and reduce the bad parts. Another thing in a similar type of way of thinking is a drug called itacitinib, which is a JAK1 inhibitor made by Incyte. And they have a trial ongoing where they're also trying to reduce the severity of cytokine release syndrome by giving this drug at the same time CAR T cell therapy. Again, reducing the overall inflammation while allowing the CAR T cells to function as normal. And so this trial is underway as well, and hopefully we'll read out some data soon. Finally, there are multiple groups around who are working on various ways to give a drug called anakinra, which is an anti-cytokine, an anti-IL-1 beta that is often used in autoimmune disease, that is now being tried in CAR T cell therapy and can hopefully reduce the cytokine release syndrome that's there. Turning to some of the other effects of CAR T cell therapy, our group in particular, or as well as other groups, have really looked at some of the clinical things that can happen to patients. And one of these things that can happen is venous thromboembolism, so blood clotting. And it's well known that venous thromboembolism is increased in cancer patients in general, and that inflammation has a lot to do with it. And so we recently published a study showing that up to 11% of patients who get CAR T cell therapy will develop new blood clots at some point during their CAR T cell therapy. Although most of these were fairly manageable, and we suggested ways that patients can be safely anticoagulated through their CAR T cell therapy. Other issues that can come up is infections and also prolonged cytopenias or low blood counts for prolonged periods of time. And people are now just describing the rates and how some of these effects are occurring. But more information is needed to really understand the mechanism of these and try to prevent these toxicities from occurring.